Well, I think what you're starting to see is a kind of a natural distinction being made. For example, a couple things the state has done. We've said that it really makes no medical sense for someone who has been fully vaccinated, who is exposed then to have to quarantine for 14 days. And we've said, so if you've been fully vaccinated, no longer do you have to quarantine. That's of particular importance, I think, to an athlete. We've heard our athletes, our high school kids who've had to quarantine, miss games, miss important things. So I think that should be an incentive. If you're an athlete and you want to have your season, don't want to be quarantined, it should be an incentive to get that vaccination. We're doing the same thing in our nursing homes. We're doing the same thing in regard to our assisted living. We announced this week that if you work in assisted living, you work in a nursing home, and you are fully vaccinated, you no longer will have to be tested twice a week. Everyone who works in those places in Ohio has to be now tested twice a week. I don't care where they are. And if people want to avoid that test, then they can get vaccinated. You're seeing the private sector start to make decisions. You saw the NFL at the draft. They had an area where you could only go into if you were fully vaccinated. So look, there's so many reasons to get vaccinated, and I think you're going to see more and more reasons as we move forward. I know some states have come up with $100. Look, we're looking at all kinds of things. If we can figure out what would really incentivize people and pick up a significant number, we would certainly do that. And we're still looking at that.
How about financially incentivizing companies to get their employees vaccinated?
Well, I think there's a real incentive for companies to do it without any money, and that is to have a workforce that does not have to be off because they get the virus, or does not have to be off because they've been exposed to the virus. So there's a real incentive for companies. I was on the phone today with a number of businessmen, businesswomen, and a number of them are bringing the vaccine directly into the company, and that's what we ask them to do, because we know that will encourage more people to get it.